I've seen at each level, at the patient level, the provider level, at the payer level, as well as the broad practice level, how measurement-based care can ultimately affect change. Feeding back this information, whether it's through graphs, in terms of you came in with, your depression was at this level, over the course of our time together, it's now reduced to this level. There's a point of validation for the patient. And so I myself as a practitioner found it extremely helpful when I was in those times of doubt in terms of, are we making progress?
Thank you for coming back to another meeting of the minds. And if this is your first time here, we look at the intersection between behavioral health, digital health, healthcare strategy, policy. We look at those. We look at those intersections to identify things that you can take back to your organizations, whatever capacity that you're in. And today we're going to be talking about something extremely important, because when we think about all these strategies and innovations that we have from a care perspective, clinical perspective, or digital perspective, they all have to add up to something. They all have to inform future strategy. And how do we do that? A concept called measurement-based care. So here to discuss measurement-based care is Dylan Ross.
We really appreciate the opportunity to sit down and talk about such an important topic.
Thank you so much. And for folks watching, we have talked about how we should have this conversation, and we want it to be actionable for people of all levels. So there might be, Dylan, you gave a stat last year that about measurement-based care, as nice as it sounds to be measurement-based and data-driven and everything like that, only about 17% of organizations are actually using that, correct?
Yeah, the research varies, but it seems like the most agreed upon numbers are 19% of psychiatrists, so physician level care providers, 11% of psychologists, clinical level, Ph.D. level psychologists, and likely anywhere between 5 to 2% of master's level clinicians report practicing the use of standardized clinical measurement or measurement-based care. I would argue that in the master's ranks, it's likely less. And more broadly, when we think about the kind of formal definitions of measurement-based care, more times than not, it's routine outcomes collection, but not necessarily the fidelity-based practice of incorporating those standardized clinical information into case conceptualization, as well as making informed clinical decisions within the course of care to adjust treatment plans and really kind of dial in what's going to be best for that patient using that information. So again, broadly, this is woefully under-practiced in the field and a significant area of opportunity, as well as an area of passion for me personally.
Fantastic, and we're really hoping to dig deeper into that passion, what you've seen beforehand, and what you ultimately learned, and what drives you down this path. And I hope that people listening can they hear the points that you were making about it and hear about the significant underutilization. We actually wanted to get into that too, because just with respect to clinicians and all of the things that you're asked to do by your organizations, it does feel like there's a possibility that if this isn't implemented correctly, if this isn't communicated correctly, then that could be the cause for like a lack of adoption of these methods, right?
Completely. I mean, when we think about the facilitators and barriers to the practice of measurement-based care, or even just the implementation of measurement-based care, many of these are just kind of base-level practical things. And so thinking just in a pragmatic fashion, talking with frontline patient-facing care teams, it comes down to, is the collection of this information easy? So thinking about administrative burden in terms of collection. Oftentimes, if there are screeners, they're filed somewhere within the depths of a multi-page packet at intake, where there's just a laundry list of paper-based questions that we're asking the family or the individual to fill out. Those are often then scanned into electronic medical record, or it's required for duplicative data entry. So there's a lot of inefficiencies around how we collect this information. Now, there has been obviously some great advances around how technology can support this type of information capture and ultimately be ported into and stored in a discrete fashion, electronic medical records. But the realities of just collecting it, making sure that it is stored in a discrete fashion, meaning, each key piece of information is stored in a way that can be either, accessed by that clinician or, by the organization itself to pull that information in aggregate. But long story short, there's just real world friction points around collection. In terms of practice too, as we think about the pipelines in which we train our mental health workers in this country, there are just so many different types of clinical training programs at the master's level, at the doctorate level, even in the kind of technician level. Each one has a point of view. And when we think about accreditation and standardizing that, huge opportunity to drive a better kind of unity around how we talk about and train towards collection, not to mention then as you step forward into clinical licensure. And so at the end of the day, I think the important point is that we do not have a prepared workforce today to ultimately step into this evidence-based practice and do it in a way that is meaningful and ultimately drives outcomes and moves the needle that matters most.
There's one thing that you said a little bit earlier that I can't get out of my head. Like I'm excited by the fact that you said it, but you said that you're passionate about this process, and a lot of people, especially if you're practicing and things like that, a lot of people might look at these things as like data collection exercise and things like that. But could you talk about what's driven your way down this path and how and why you're passionate about it now?
I had the opportunity both to work for Optum Behavioral Health within the payer space, saw the criticality of why measurement matters when looking at a network of over 500,000 behavioral health providers. And then even before that, practicing as a therapist myself for Kaiser Permanente, working at a national level, working to implement measurement-based care and oversee its maturation within a clinical context. And so from practicing it myself to trying to implement it and improve it, as well as to manage teams that were really encouraged to practice this, I've seen at each level, at the patient level, the provider level, at the payer level, as well as the broad practice level, how measurement-based care can ultimately affect change. So the passion comes back ultimately around wanting to improve our mental health care system for those that need it most. And like many, I came to this field with a personal story in terms of my own family. My mother, others within my family have really struggled with mental health for a good part of their life. And I've seen the failings and shortcomings of the system. When stepping into a professional setting, I was just shocked at how some of the most simple questions were really hard to answer, such as, did my patient get better? Or is this population of patients getting better?
Wow.
And so thinking about, forgive the overused analogy, but mental health, behavioral health, substance use, we don't have vital signs in the same way that we do for physical health. If you have hypertension, you've got blood pressure. If you have diabetes, you have glucose levels in terms of blood, your A1C and the like. If it's obesity, you have weight. There are objective ways to measure baseline and change over time. And so at best, our field has created patient-reported outcomes, meaning validated tools where we ask patients to answer questions reflective of both symptomology, depression symptoms, anxiety symptoms, looking at overall function and functioning, well-being, and the like. And so as a proxy, in the absence of vital signs, we use this patient-provided information in a structured way, in a systematic way to collect that information over time. So back to the question of kind of around passion, all of this sounds really academic, and I realize that. But practicing measurement-based care myself, really coming into the field without being trained, I had no formal training in measurement-based care, yet also held a clinical license at the master's level. I hold a Ph.D. as an organizational psychologist, so also had this kind of broader system level view. But back to it, it wasn't until I started practicing the use of using these types of measures and collecting that information and bringing it into the session with the patient that I saw, it sounds a little cheesy, but the magic of what can happen. There's a point of validation for the patient, as well as there's a lot of subjectivity to how psychotherapy is delivered. Just to kind of cast a light on history here, I mean, talk therapy as we know it today hasn't changed much since the 1880s. And as we think about that evolution, there's interesting kind of structures of power differential, the kind of white coat effect of like who's the expert, who needs help, and who's the care provider. And so there is this kind of leveling that can occur when you start to take steps towards a bit more objectivity within the subjective context. And so I myself as a practitioner found it extremely helpful when I was in those times of doubt in terms of, are we making progress? Is my patient getting better? To be able to look to these types of patient-reported outcomes. And so also too, just seeing its impact on the consumer, the patient, the client side. If anybody's had the experience in therapy themselves of coming in and just feeling a bit muddled in terms of where I am with my depression, where I am perhaps with my anxiety or my relationship issues, it's that snapshot of time. And so when we think about how limiting it is, that as the clinician, the only available information more times than not, back to the numbers of just underutilization of the practice, you only have what the patient brings in that 50-minute session, if we're talking typical outpatient, to work with. And so to be able to collect this information not only either right before or within a session, but also within and between sessions, track and trend change over time, and then ultimately apply all of the upside of using data in new and novel ways. Again, back to kind of that leveling within the system, patient level, provider level, and practice level, and population level. And so all of a sudden when you have numbers, the old adage, you can't improve what you don't measure. Mm-hmm. This is one of those situations that when you have that bolus of data, that all of a sudden there is an opportunity to drive different types of change and measure its impact on the ultimate care process.
Great, and your answer hit on something really important, which is a lot of people might look at what happens in, for example, electronic medical records, and especially in other modalities, as like data collection exercises that have no value for themselves, no value for the patient. You, in framing this, like, a lot of times I'll hear conversations about what's the ROI for the facility or for the organization, but you pointed to something that was a return on a return for the patient's time. Like a lot of people give up their data for various uses, but they get nothing back from it. But the picture that you painted is different than that.
It's interesting. I've worked in a model before where we would collect information in this way. Oftentimes paper and pencil, other times through app-based collection, where it was really unidirectional. And we were asking the consumer, the patient, the client to provide information on how are they doing today. And when you break that feedback loop, it really changes the dynamic. And there's actually interesting research out there that points to it's actually the inverse. That if we only provide that information to the patient themselves, that we actually see a significant lift, even if the clinician isn't using it. And so there is this kind of validating effect where providing mile markers of change, especially when it's change that can be oftentimes a bit blurry or subjective to the patient around, am I getting better or not, is really, really helpful. And it can not only motivate and activate patients, engage them in new and novel ways, but to see progress, at the end of the day, it helps the care process outright. And you mentioned electronic medical records. I think it's also interesting to consider from an administration or an organizational kind of perspective, how this is really sensitive information. And not only for patients, of course, but for the workforce. And there's a lot of strong beliefs around the mechanisms of change within therapy. I bet if you polled a room of 10 various level clinicians, 8 to 9 out of 10 would say, above all else, even above evidence-based practice, the relationship is the most important thing to ultimately affecting some sort of change in therapy. And so there is this strong autonomy and a sense of ownership of clinicians around the care that they provide and how they provide it, as well as a strong sense of ownership of that relationship. And so the minute that you start to take what ultimately is at times seen as a black box, the minute that door closes and they're in the session room, a patient, a client, a consumer, and the clinician, it's just the two of them. And to start making that a bit more transparent at times can feel a bit vulnerable for the clinicians, as well as, I think, real and valid senses of distrust between, say, administration or even the organization around how are you going to use this data? Are you going to look at how effective my care is in terms of me compared to another clinician? And it starts to invite a lot of questions around how this information is used. So when we think about implementing measurement-based care, which is a very strong and powerful evidence-based practice, it's really important to consider the change management aspects and ensuring that those that are going to be practicing this use are involved from day one in understanding from top to bottom the why, even more so than the how. And really creating that contract of understanding within an organization and care team of trust and some of the boundaries around how this information can be used.
All right, so as we're talking about this measurement-based care, you brought up a return for a patient, and it's like, at least in the data that I've seen, and this is just purely from a digital health perspective, but we actually see that people really like to see how they're trending over time with regard to their behavioral health measures, just within an app perspective. But curious about that return that that is for the patient is clear, but how are you getting clinicians involved, and how are you engaging them in a way, like what's the change management approach that you have in mind for these efforts for clinicians?
So how we engage a new set of clinicians that may be naive to the practice of measurement-based care, I think is important and needs to be intentional. I would argue that most therapists, clinicians, patient-facing roles within a clinical team, they really, from a patient centricity standpoint, they want to see their patients get better. There's a professionality as well that is within this context, that clinicians really see themselves as that professional, and so continued professional development. And a gathering point between both what is of value to the patient and what is perceived to be of value by the care team or that therapist oftentimes comes down to, let's work together to get the most effective outcomes in the shortest period of time. Said another way, how can we reduce the suffering? And so I think coming at it from a humanistic perspective is really important. While not all data and research is the most convincing, it is a good point in terms of looking at, we find that when measurement-based care is practiced, especially practiced with fidelity, not only do clinicians pick up more reliably on a lack of treatment and response earlier, but they're also empowered to have those signals through measurement-based care to ultimately empower them to make treatment changes sooner within a care episode. Said another way, it's really starting to look at use of validated tools, systematic collection of patient-reported outcomes, compared to just clinical judgment alone. And the evidence is extremely clear that there's an overappraisal by most clinicians, and they over-index on clinical judgment when they can invite in an additional data source and actually make changes sooner, make care more efficient, and ultimately, more times than not, achieve what the patient feels, their patient, is most important to them, which is achieve my treatment goals and symptom reduction, oftentimes increased functioning in the shortest period of time possible. And so there is this kind of meeting of the minds in terms of kind of the orientation of patient centricity, the continued development of honing one's practice in a continual fashion, and ultimately being able to be more effective in the most efficient amount of time. And oftentimes those are, in essence, saleable points to the frontline teams. But I will say this, you know, I often would have conversations with my teams, you know, don't take it from me. And it really comes down to kind of, you know, attraction, not promotion. Mm-hmm. And if I can find a single provider within a team or clinic that is practicing this, there is this moment of aha, and when it clicks, and they realize how powerful this practice can be in helping them help their patients, that voice becomes ultimately the most important one in terms of scale and spread, because that peer-to-peer collegial kind of promotion is really what will help drive earlier adoption, not administration alone.
Very important point, because who would want to make the change if there's not some validated way, be it through, if nobody else in the organization is doing it yet, then understanding like some of the literature around it, or like the more powerful example I think is, you know, based like somebody makes that data-driven decision and then it starts changing their practice, that serves as a light for others.
And the other piece too, you know, so often measurement-based care embraces the use of validated tools that are really focused on kind of sickness symptoms. Mm-hmm. Best practices also incorporate questions around therapeutic alliance or the patient's experience of the relationship or the treatment process. And so inviting in a different kind of word that is within kind of a similar lexicon, feedback-informed care, has done a lot in terms of bringing in this kind of meta-level conversation around, here's the work that we're doing together around your fill in the blank, depression, anxiety, relationship issues, the list goes on. But then there's also the structured use of, you know, to what extent do you believe that we're focusing on your treatment goals? You know, how comfortable do you feel, you know, talking about things within session with your, I mean, the list is many in terms of asking the patient to provide a perspective on the care process. As a therapist myself, using that information, oftentimes it's uncomfortable to have a direct conversation with your therapist that today I felt like we were working on your agenda, not mine. I didn't feel like I had an opportunity to tell you that despite, you know, we've been talking about this for the X number of sessions, this event happened to me that was really important, and that would have been great if we had some space today to get into it. Oftentimes, you know, that first question sets the course of the direction for the therapy, unfortunately. And so being able to collect this information around how's it working for you, how are we working together, do you feel like I'm working towards your goals, can start to create a safe space to have those conversations, despite how uncomfortable it can at times feel for the therapist themselves to either ask it or receive it.
Given the advantages that it offers for patients and for clinicians, what can you see have been some of the barriers? Has it been poorly implemented in the past? Like, because to me, the number hovering below 20% sounds like a really low adoption for something that should be more widespread. So what would you say has been the cause or the contributing to that?
We talked about some of them. Administrative burden. We talked about some of the belief systems, biases, and attitudes of therapists that are practicing. We talked about some of the shortcomings in terms of training and ultimately achieving that prepared workforce that is competent and ready to practice this. But another important thing that we'd be remiss not to mention is just looking at ultimately reimbursement. And unfortunately, the system that we work in today is really kind of volume-based, fee-for-service. And CPT codes ultimately guide much. And while there are codes that, billing that can help pay for or at least offset some of the costs of practicing this, the reality is, just dumbing it down, you get what you pay for. And we don't have the right incentives today to ultimately pay for this. And there are some big questions that payers, national payers, large advocacy, professional accreditation groups are struggling with. Because on one hand, there is a point of view that measurement-based care should just be a part of therapy. And so why would we pay for something that should just be happening anyways, when also kind of holding the duality of, well, by the numbers, we know it's wildly under-practiced. And so from kind of a viewpoint around increasing adoption and use, how might we put the right incentives around the promotion of a new practice or set of behaviors. We need to kind of think more broadly as a system where we're not nickel and diming every single kind of service that occurs within the course of a treatment episode and start evolving our thinking around more of a value-based or outcomes kind of oriented mentality when it comes to reimbursement. And further, you mentioned in apps, technology is a huge facilitator. And obviously there are kind of the human aspects of practice training and such, adoption and use. But technology can be a tremendous facilitator of this. And so I think that there's a point in the near future where many of our interoperability challenges will be a thing of yesteryear. And looking at ways that integrators across systems can help support this. But today we have siloed data, inaccessible to many, oftentimes just data is outright missing. And so when we think about how we might leverage technology in ways that can kind of make it easier for all within the ecosystem to be working off the same source of truth, whether it's pharmacy behavioral and medical claims, clinical outcomes, provider level performance, the list goes on in terms of all those metrics that matter. But at the end of the day, measurement is needed, measurement is effective, measurement requires appropriate incentives, and we as a healthcare system need to first start by stepping into the shoes of the consumer, of the patient, of the client, and really design from that end user backwards, while also taking into account other customers within this system, which are the most important group in terms of those that are doing the hard work of delivering to their best degree effective care as much as they can in terms of the mental health workforce.
So I imagine as you roll these systems out, data starts flowing in and you start looking at like current clinically validated ways of like measuring care over time. I wonder, because those methods were made and were created in times before, but before this paradigm. So I wonder if this has opened up new ways or new measures. Like what have you started measuring additionally outside of like the common crop of clinically validated measures?
I love that question. Wholeheartedly, quality has oftentimes been focused on sickness and efficiency. Whether it's HEDIS, Medicare 5-star, a lot of the kind of formal quality metrics that oftentimes health plans and large systems care about. And we need to pivot as a field towards more of a positive psychological orientation, meaning really start measuring the things that we're really striving towards, such as wellness, such as flourishing. Harvard has been doing some really impressive work around, again, kind of reimagining how we conceive of quality. And they have created not only a validated screening tool and assessment around flourishing measures, but really getting towards, that end goal. Success oftentimes is set at a low bar where somebody may achieve, a clinically validated reduction in, let's say, depression symptoms. But that's such a small slice of our overall whole. And when we think about the holistic orientation of all of our lives, think of all the different domains, physical health, mental health just being some of them. But as we expand that aperture into social, spiritual, community, familial, economic, it starts to change the types of questions that we can ask. And I believe we need to start challenging our health systems. We need to start challenging the bodies that ultimately pay for a lot of the activities that occur within healthcare, to start thinking a bit more broadly around what is effectiveness, what is quality, and really think about a broader view of humanity. And I know this is getting kind of out there, but back to it, thinking about this construct of flourishing. What is living a full life? And at the end of the day, a PHQ-9 score of, 9 or below, 10 or below, the list goes on, it really doesn't matter at all to a patient. They have their own set of interests, goals, motivations in terms of what their hopes are out of the care process. And we need to keep up with really being patient-centric in terms of designing systems of measurement and quality assessment to kind of stay in step. So we've got work to do, and there's great work happening in that space.
Well, fantastic. I feel like we're aligned there. There was a little secret thing that I was trying to do when I asked that question, was to just break it down to the idea that we're more than just the singular numbers. And of course, like I was asking about other metrics and other things that crop up, but the whole idea is to move us away from just looking at these singular metrics and start learning from what we're learning how we expand our overall measurement picture.
If I could just add one more comment, back to kind of the change management aspect. A phrase that I wish I had, maybe a quarter every time I've heard it, this concept of like treat by numbers. And this cookbook medicine, there's these kind of adages that oftentimes come up in the context of starting conversations around implementing measurement-based care. And at the end of the day, there's actually some, truth to them. Yet, as we kind of expand our view, this needs to be one part of a greater whole in terms of how care is delivered, and can't be the only piece of information that is ultimately driving decision making. And so at the end of the day, I know I referenced the fact that evidence points to, at times, these validated tools being more effective to work off of than, say, clinical judgment. I do want to just kind of re-emphasize that we can never take out the practitioner and ultimately the holistic set of all they bring into that care process. So this is a tool. This is an evidence-based practice, and one that should be set alongside of all of the other wonderful things that our mental health workforce is practicing every day.
And there's a question that they asked a little bit earlier today in the session is if you could wave a magic wand and change any one thing about our healthcare system, what would it be? So that was very similar to the question we asked at the end of each episode. So suppose panaceas do exist and you can wave a magic wand, what would that be?
Wow. The power of that opportunity. We need more humanity in healthcare. You and I had the opportunity earlier today at this conference to hear some really provocative calls to action around equity. and thinking about healthcare being, again, more broad than just sick care. My magic wand would be to ultimately redesign healthcare systems to really prioritize the value and humanity of all, and through that process, ultimately, my hope would be that we would see many of the health disparities close, and we as kind of a community take steps towards the justice of health. It's really unfortunate that we have a system today that so many are ultimately left out of, and opening that door of healthcare more broadly to invite all in is something that, while a bit audacious, I would use my one magic wish for.
Well, the genie, if we had the genie of the lamp, I would love to see humanity restored here. For other folks who want to see humanity restored, but at the same time want to measure our path there, how do people reach out to you?
Yeah, thank you. I appreciate it. Feel free to look me up on LinkedIn. And I also serve as the vice chair of the American Psychological Association's Measurement-Based Care Advisory Committee, and through those channels as well. Please reach out. This is important work. This can change the way in which we help advance care for those that need it most, improve the practices of those that are delivering this care, but also drive more efficiency and better outcomes through the evidence-based practice of measurement-based care. Feel free to reach out.
In addition to that, Dylan earlier referenced, and this has been a topic that's been heavy at this conference, but he referenced the structures and incentives around value-based care. We actually recently had a conversation with Antoine Williams specifically about the actions that you can take to start getting your hands dirty with value-based care initiatives. You can go ahead and click that link, and we will be looking forward to seeing you next time.